So we now know true links with dementia, with heart problems, with gut problems. And so this is something that you can totally take care of. And it's so simple.
Dr. Samir Patel. He's the #1 dentist in London.
And trains the next generation of doctors to be the best.
He's here to reveal
how the health of our mouth holds the secret
to the health of our entire body.
What are the biggest misconceptions people have towards oral health?
Everything will be okay because you don't see the mouth. And 70% of tooth abscesses are silent. So often the patient won't even know about that.
Unless I'm a professional, I wouldn't necessarily have all the information towards my health.
We're there to be a detective, to see patterns, to see problems. There's been a number of times that we've picked up diabetes in the mouth. We're realizing actually this is the problem. Not only in the mouth, but across the body. The biggest misconception in dentistry is actually...
Hi, Dr. Samir Patel. Could you tell us what's your mission as a dentist?
My mission as a dentist is really trying to help people, connecting with people, but allowing their oral health to be infection-free, create longevity, and often create a wonderful relationship with my patient that can help them on their journey of dental wellness.
Oh, wow. And I believe oral health is quite important for our day-to-day life. We all get up brushing our teeth. We all go to bed brushing our teeth. And so start with our daily routine. What are the habits we're supposed to do towards oral health? And how are we supposed to brush our teeth every day?
Well, I think the importance of brushing our teeth and keeping our teeth clean is really important. And originally, I think we initially thought that it was just the mouth. And now we know there's a huge connection with the brain, with the heart, and many parts of the body. So I think brushing your teeth is just the foundation of good oral health. Having the right techniques, having the right information, right instruments is all part of that oral health, and I can't wait to share with you some of those little tips and tricks.
Yes. Well, I think all of us know how to brush our teeth, but maybe some of us don't have got into the right habit, how exactly we're going to brush our teeth. And I heard people talk about mouthwash and floss and even tongue scraper. Could you tell us, like, with all those tools or all those products we have in the supermarket, what are the essentials of oral health if you want to put it into your practice?
So that's amazing. All those tools are very important. So if you think of your mouth as a whole, you have the soft tissue, you have the tongue, you have the teeth, and you have the gums.
Yes.
And so 80% of your bacteria is actually on your tongue in the mouth. And so therefore, when I visited a fresh breath clinic when I was younger and I was training, actually that was the key secret of fresh breath.
Okay.
It was after you've brushed, get a professional tongue cleaner. We recommend a metal one, and then brush all of that fur off your tongue. That's number one, going to give you reduced bacteria levels in the mouth, fresher breath. Then you've got all of the oral cavity, which is the softer tissue, and just mouth rinsing with water is generally good enough. You don't have to do anything. If you do have injuries, you've got ulcers and things like that, hot salt washes are amazing. Still very organic, very simple. And then when we talk about the teeth, you've got to almost see the teeth as a cube. And so if you're toothbrushing, you're actually only cleaning 3 sides of that cube. So the floss is to then get in between, and the little triangle at the gum right at the bottom is the little brushes. So ideally we want that all, because the concept of brushing or some type of movement in the mouth is to prevent good bacteria, which we want in the mouth, from aggregating and changing over to bad bacteria. That's simply what happens. And then the bad bacteria release endotoxins, and that creates the damage on the gums, which then to the softer bone wants to move away, and the teeth either get recession or loose, and then they fall out. So really we want to be preventive on that front, and actually toothbrushing alone generally is not good enough. If you're lucky, your genetics allow you to get away with that, that's great. But actually that just brings in then the hygienist and the importance of seeing the hygienist, because ultimately they're your backstop. And if you've not cleaned an area well and the bacteria is going from good to bad, they then just have the opportunity to come in, do the clean, vibrate away that bacteria, and then it's got to reset again to go from good to bad. I hope that helps. And that's just like a simple analogy of the mouth and how we can keep it a little bit cleaner and healthier.
Wow. So there are few things you talked about I feel is very useful and helpful. And think about if in an ideal day that I want to get up from the morning to the night, how will that routine be since the morning, like first thing when I wake up? How will be the whole process? Should I do the tongue scraper first, or should I do the brushing first or flossing first? Can you walk us through a daily routine?
Yeah, and that's a really good question, Méline, because actually the biggest misconception in dentistry is actually when to brush the teeth in the morning. And it has to be first thing, because you have bacteria in your mouth that if you then eat is going to be broken down into the acid. It's going to start wearing the enamel with the acid, and then you're going to brush your teeth and you're actually rinsing your enamel away at that stage. So we've got to do it the other way around. We've got to brush first, remove all the bacteria, then go and have your food, and it can't do any damage because there's no bacteria in the mouth, and then you rinse your mouth out with water and you're off for the day and have your cup of coffee as well.
That's actually true, because one of the person told me, oh, you should eat first and then you brush so that you don't have to brush twice if you want to have a good breath. But when you explain it this way, I feel like I'm eating all the bacteria.
No, we're not having any of that eating of the bacteria anymore. But actually, then once you've then brushed your teeth, you're then cleaning your tongue, and really you're ready to go for the day. And then whatever food you have, like it's really good practice to rinse around with your mouth and gargle and whatever that is, just with water to get rid of that extra food, and you're ready for your day. And I don't mind, if you're having a chewing gum, a sugar-free chewing gum in the car on the way to work, and then that's fine. You're ready to go. You're fresh breath, and really, there you are. Yeah. And then at lunchtime, if you get a chance to use just a simple mouthwash after lunch, or a chewing gum, I don't mind that at all. If you want to be a gold star, a quick little clean with your toothbrush, and then we talk about the evening. Then, so you've got to the evening, and you're about to go to bed, and it's got to be the last thing we do. Yeah. It's brush your teeth. And we often have a bit more time now. In my routine, for sure, I do my interdental cleaning, which is the floss and the little brushes at nighttime. Then in that instance, again, it's quite often people will brush their teeth and then floss and use those little brushes. In fact, it's the other way around. You've got to think of the floss and the interdental brushes as like a pre-wash to cleaning your teeth, loosening it all, getting it all out, and then coming in, brushing your teeth, and then rinsing around, and then using the tongue cleaner as well. However, some colleagues think you shouldn't really rinse around heavily at that stage and leave some fluoride on the teeth to allow your enamel to remineralize for all the damages that have been done over the day. Now, there's not enough evidence to say one way or the other, but I don't think that's a bad thing to do at all. As long as you're removing most of the toothpaste, it's a wonderful way to remineralize your teeth, especially if you've got sensitive teeth, you've got susceptibility for decay. I think that type of patient, it's a great idea.
Oh, wow.
And the beauty about dentistry and the preventive dentistry in today's world is that really we're seeing an insight into somebody's mouth. And so like the skin, which is our biggest organ, you often see psoriasis, eczema, and different lesions on the actual skin. And that's just a reflection of what's going on inside the body. That's inflammation for somebody. They're reacting to either something they're eating, the stress, or the rest of it. And that is what we're seeing. So actually inside the mouth, when we take a look, we can see many oral lesions that can then give us insights into other things that are happening, not only in the body, but second of all, inside the gut.
Oh, wow. And what are the biggest misconceptions people have towards oral health and dentistry?
I think the biggest misconception is that everything will be okay because you don't see the mouth. Oh. And so some people will often not go because they just think, actually, you know what, I don't need to, I'm not having a problem. But actually that doesn't mean there is not a problem. Yes. I think that is my biggest concern when patients say, I've not really got a problem, and therefore you then start taking the x-rays and there's infections, and 70% of tooth abscesses are silent. So often the patient won't even know about that. So what we want to do is be totally preventive. And, private dentistry or dentistry in today's 2024, what a beautiful place we're in. We are seeing the patient every year for their health, to tell them, don't worry, this is something we're watching, we've got you, and I'll see you next year.
Yeah.
And then they come back next year and you're seeing some movement, and you may say, actually, I think this is the right time to do some treatment for you here. That is totally preventive and predictable work we're doing without anything major. Can you imagine just we were doing small, tiny fillings, or telling them to brush in an area a little bit better, saying, actually, I'm going to change you from 6-monthly hygiene to 4-monthly hygiene. That change has changed the trajectory of their mouth. And the fact we live to 90, 100, maybe more now when we're older, like this is such an important way to be able to increase your predictability for oral health. And keeping your teeth and keeping them in a good shape, which ultimately is the foundation for me for that dental wellness and longevity. Because if you haven't got your teeth, you're not able to eat properly.
Yes.
And then there's problems in the stomach and in the gut. So what we want to do is something that is so predictable that we can totally take care of. Why don't we try and do that? And therefore, seeing your dentist regularly is just part of that.
Yeah, I totally agree with you on that point. However, I would say the reason I start to go see dentists again is because there have some pain in my teeth. I said, okay, I need to go see a dentist. So I didn't go to dentist until part of, one of my cavities getting really bad. And then I start to visit dentist regularly. And I'm glad I did so, because since we met, I never have a problem because every half year I would go to the hygienic sessions, and then I just have such a good confidence my teeth wouldn't just suddenly, pain on me, right? And if the people who have really bad experience or memories with dentists, how do you suggest them to rebuild this trust with their dentist? And how often do you think they should go visit their dentist?
There is this thing in dentistry that yesteryear patients just didn't have good experiences, and we have to accept that was the case. However, in today's world, with a dentist that is trained, has you at the forefront of their thoughts in terms of what they want to do, you have this preventive sort of nature, and we have amazing now advances in materials. And also we work almost with microscopes doing our dentistry, so that we're almost like really taking care of that tooth at a microscopic level. Yeah. And so therefore the precision and the quality of the material leads to greater predictability. Yeah. And our anesthetics are better than ever. And so when you add that all together, often our experiences in today's world can be quite remarkable, actually. And so to win a patient back from somebody who's had trauma, I think it's a slowly. But the first thing is dentistry is different now. And often I have to tell patients, look, we have to close that door and we just got to open a new one. This is dentistry today. And I appreciate where you're at, but you're in control. Raise your hand, we'll take care of you, and there will not be any problems. Yeah. The one thing I do see is that this whole negativity in yesteryear dentistry can often get passed on to the next generation. Because actually there's a phobia about taking their children to the dentist. And therefore, that can go both ways. One is there's a phobia, and therefore whenever they go, they're saying, this will hurt, but you've got to get on with it. I'm like, no, we've got this. Yeah. Or the other thing can happen is actually that parents can feel so traumatized that they feel that they've got to give their children the best. And therefore, they're brought very early, very regularly. And you can see these patients, they're hugely different. One is almost implementing their yesteryear thought on the patient, on their child. And one is trying to give them a new lease of life in terms of the white coat issues that are there. But like in dentistry today, if you get the right dentist, and there's a wonderful expression called trust benefit. Trust benefit is when you've got to know that patient so well and you're recommending a course of treatment. And they're coming in so comfortable that course of treatment is right for them. They are so relaxed in the chair that my neurochemistry is so relaxed that I can perform at my highest level.
Yes.
And actually, if I feel upset or I feel negative about a patient, often that may happen once or twice a year, it's better I don't treat that patient.
Oh.
Because actually the beauty about the relationship is that you get along so well, you're so comfortable with each other, and you trust each other completely. That she trusts that I'm going to get a great job here, and I'm so relaxed that I'm going to do a great job. You know, when you're nervous or you're running late or the patient is demanding something, like everybody's neurochemistry is different on that. So therefore, how can you perform at the highest level?
Yes.
It's very difficult. So the longevity of your relationship, understanding that patient needs and concerns is all part of those early steps when you first meet a patient and you build up that trust, because that's a beautiful place to be, not only for the patient, but also for the dentist as well.
I love that words you have mentioned about the trust benefit. I do sense that after we met, I remember the early treatment, you taking photos of each stage. And for me, I really love when I see the progress, and I love to see that's based on fact. It's not just you tell me it's getting better. I see in front of my own eyes it's getting better. And over the time, I feel every time I go to you, it's not that painful. That's the best part, because before I hear the drilling of the teeth, it's really, just got me goosebumps to even think about it. And, the biggest part of our podcast, we believe that you're supposed to be the CEO of your health and your brain. I really believe for everyone, they should take full responsibility towards their own health, rather than just say, okay, I trust this person, here you go, I'm not going to think a moment about it. I really don't think that's a good idea to go. So if I'm a patient and I want to find a good dentist, how can I identify the good one from the bad ones? Because you are blind. You wouldn't know what's happening when you
sorry, we're laughing because I shared with you what a patient came in today with, and he had just typed into ChatGPT, who's the best dentist in London? And then he said, look, I've got a screenshot that you're the one. And so he came to see me. But I mean, like that, the patients can come from anywhere.
Yeah.
But how you're choosing somebody, often word of mouth, 60-70% of our patients are word of mouth. And I think still that old network, not ChatGPT, it's great we had this family come and join us. They're lovely, by the way. But often it is word of mouth. So when you like somebody's smile, or you think somebody's got a way about them that they're very serious about health, that's a great person to speak to and just say, look, I've moved in the area, I'm local now, and I'd love to understand, is there a good dentist that you use or recommend?
Yes.
And then this is like summing up. Why don't you go and have 2 or 3 consults? Like, you have to do your due diligence to meet somebody that you feel comfortable with it. And I may have somebody that doesn't quite align with my visions and the way I think about things. It's better they go and have somebody that they feel comfortable with, and that trust benefit is there. So I think nothing better than asking friends or family that are in the local area who's the best guy. But also somebody's got nice teeth as well. And that that somebody is concerned or would have researched wellness, or somebody in that health space. I think that's a really important tip for today.
It's funny enough you bring it up. When I first moved to London, I think it's 4 or 5 years ago, that time I just Google it, and I find few recommendations, and I see each individual of them, 3 of them, and I choose the one made me feel most trustworthy, because it's always in my mind, one choice is not a choice. I need to hear different opinion towards one piece of health issues that I have. And in the end, I choose your clinic. And I recall it's quite a beautiful clinic aesthetic-wise, and all the people working there seems happy. And for me, if people are happy and passionate about their work, that's a good indication of they potentially good at their work. And then you need to see their work. And I became a good client ever since.
Yeah, no, we've loved treating you, and that's a good point, because actually happy staff are showing that from the leadership there's something good happening there. That's in any business. That's just not in dentistry. Yeah, I think wherever you walk in, you can feel this either attention or this the beauty about the teamship that in that place, and I love that teamship, and I love making sure that my staff and my team well looked after and enjoy their day. I want them to be enjoying them day, because actually, work is something that I enjoy, and you know how passionate I am about this. So I would want them to feel the same way and represent me that way.
And do you think, being in the profession as a dentist, what is your point of view on oral health overall? Like, I feel I probably don't think about it much into my daily life, but in a professional point of view, how you see is the biggest mistake people make into their day-to-day routine?
Well, I think oral health now, and we sort of touched on it earlier, that it's actually much wider than the mouth. And we never knew this. And I can paraphrase like the Huberman lab. And now they've laid the 7th pillar of health, along as with stress management, diet, sleep routines, nutrition. They've added oral health.
Yeah.
Because actually that's remarkable for me and all of my peers that have been banging on for years, like how important this is. And so we now know true links with dementia, with heart problems, with gut problems. And so this is something that you can totally take care of. And it's so simple. The routine we've been through on a day-to-day basis, your consistent performance for that is exactly taking the CEO-ship, as you say, for your oral health. And that's not, it doesn't stop there, because, you're the CEO for what you put in your mouth, when you eat, your Atomic Habits, which is one of my favorite books by James Clear.
I love that book.
Just having your atomic habits right, from putting your clothes out in the morning, through to your oral health routines, through to gratitude, through to meditation, whatever that might be, that has to be the pillars of your day. And once the pillars of the day are in, then you can put the rest in. And I think that is more how you then construct a more successful you than allowing the world to have its impingement on you. I hope that's answered your question.
Yeah, definitely does. I really agree with you. Once you laid that foundation of your morning routine on how do you take care of your health, it's obviously give you a sort of confidence and security that you can just go working on your task. Because they said the healthy person have 1,000,000 dreams, but the sick person only have 1 dream, right? Yeah. That's a part of that kind of mindset thing. And actually would love to touch based on the oral health and also the aesthetic wise for your teeth, because I notice when the moment if I have a sore on my teeth, let's say after operation, there could be a blood that not be washable for the second day. And I do have this worry, like, oh, I might have, like, will people think I have a piece of food on my teeth? But I know that was just, the sore. So with the people who potentially don't born with a very straight teeth and things like that, should they consider the bracelets? Are they only for the aesthetic reasons, or to put on the bracelets is actually good overall for your health?
Yes. So Méline, this whole thing about aesthetics and cosmetics is rightly so. It should be thought of as part of dentistry. But I think when it gets thought of as dentistry and it becomes a quick fix, that's often when the problems will come in.
Yeah.
And so the layers really, I think, that allow the top dentist to perform at the highest level is when they sort of fuse function, health, and aesthetics together. And I think, let's say in the 1980s and 1990s, I think there used to be a whole, maybe just before that, there was a whole thing about the function health. But I think at my age, and dentists of my age, actually, and definitely younger, there is this whole balance of aesthetics have got to come in, and they have to be even. The Venn diagrams have got to absolutely intersect evenly. There can't be one overriding another. Otherwise, the house tends to fall down quicker. The actual longevity of the work that's been done won't last as long. And we spoke about what we're trying to do is get the patient over the line in their 90s and 100s.
Yeah.
So actually, when you concentrate on the aesthetics, and let's talk about turkey teeth for an example here, where people go over for a quick fix.
Yeah.
Well, you tell me anything in life that's a quick fix that actually will be safeguarding that person, especially in health. I think there's very few, and I'm even struggling to think about them.
Yeah.
And therefore, organically, if you've got to function correctly, orthodontics and braces are just the bedrock of anybody's mouth being in the right place, your teeth being in the right place, allowing the jaw to be in the right place, allowing your spine to then work in the right way. How many times have we treated teeth and got them right, and patients would say, you know what, I used to have this chronic backache, I didn't tell you, for about 12 years, and I don't have it anymore.
Oh.
So we already know there is so much link, but if we do proper dentistry at the highest level with this patient-centric approach, where we're trying to do everything at the right stage. Now, I appreciate not everybody can afford everything straight away, and I'm very fortunate in where my clinic is. But actually, that's not a problem. Let me get your teeth in the right place, take a break, come back to me when you're ready, and then we can complete.
Yeah.
And there are many short ways we can sort of cover that gap until we're ready to go. But ideally, this functional health is together, and that's what braces are all about. And if they need to be put in the right place, they can be put in place. But then if you're going to do whether it's composite bondings, whitening, or veneers, once they're in the right place, that is actually where the longevity comes in.
Yeah.
And actually the true beauty is there. And you often can't tell if the veneers have been put on or not put on, because it looks like it's coming out the gums. The gums are in the right place. You're only putting like a shellac nail, and it's so thin on the teeth, and it's like, wow, what a beautiful change. Yeah. And you take full control of that. So I think we've got to do it properly, and as a profession, we have to safeguard our patients, and I think we do that really well in this country, because I think we're paid on item of service.
Yeah.
So therefore, the beauty about that is, like, when you have a problem or you're suggesting something, you're up front saying, look, this is what the cost is. And then you have a discussion about the right way to do it. And either they're in a holding pattern, and most patients will have been wearing their teeth. So if they continue to wear their teeth, often they'll end up with a bigger financial as well as biologic bill. Whereas if we can stop them with a night guard or just prevent them getting any worse, that's their holding pattern. But actually doing the braces, putting the retainers on, and then doing the veneers or the composite bonding to rehabilitate the enamel as it was, that's the ideal.
Yes.
So, and majority of patients actually fit into this because the bite is not ideal.
Yeah.
So we've got to do this properly. We've got to do it patient-centric. And we've got to then have the longevity, as we've spoken about all the way through this, as the forefront of anything we decide to do.
I have heard one of my physio tell me that think about our skeleton. Teeth is actually part of the skeleton that exposed outside. When the teeth is not straight or they're in misposition, the whole shape of your skeleton will change. When people consider about doing braces, what are the types, and is there any age limitation? Is there someone too old, too young to do it?
Yeah, so the braces come in a variety of braces, and I think the evolution of that has been incredible. So originally we had the silver braces, and then they have the inside braces, and now we've got the white braces, we've got the gold braces.
Yes.
But there's also clear braces as well, and that really over the last 15, 20 years, that's been the advent of adult braces, and it's made it manageable for people to have teeth that aren't in the right place, be put in the right place, and therefore function and have that confidence of a straighter teeth. So that evolution has been massive, and I think more than ever, orthodontics is still thriving, and it will continue to thrive. Actually, in some countries like Brazil, it's like a statement of wealth if you've got braces on, and often people have them for 4, 5, 6 years just as that statement while everything's straightening, and they get to spread their payment over 5 years. And so it's an incredible, like when I went there, I was like, everybody's got braces on here. So just coming back to the age side of things, not at all. I think if there's a severe discrepancy skeletally, that's like the size of the jaws and things like that, or there's a tooth coming in the wrong angle, early treatment between the age of 6 and 11 is amazing. But I think really majority of children are treated between 11 and 13 traditionally. You can do a little bit before, and obviously once you get them after that, the compliance of the child obviously is worse. And that's why the NHS in this country actually, I think, fails these children that are on the waiting list for so long. They actually end up with treatment when they're 15, 16, 17, and actually the children don't want braces.
Oh, yeah.
And we could have solved so much decay, gum problem, confident, like if we had done them.
Yes.
You know, for me, braces for children is like the best gift you can give them with education
Yes.
and some atomic habits.
Yes.
But really, that is an amazing way that the child will have straight teeth, that confidence of having that clean smile. So much easier to clean, less susceptible to decay, less susceptible to gum problems. So that is where majority of people are treated. But actually, a lot of people weren't treated. So therefore, adult orthodontics, or they didn't wear their retainers.
Yeah.
So we're now in a position actually where adult orthodontics is so big. And also when people want the aesthetics and we educate them that actually the right thing is to put the teeth in the right place first,
Yeah.
it's become a really, really big part of what we do at the clinic and I think most advanced clinics around the world now.
Yes, but I think most of the people, when they put on braces, they will need to take off the teeth. And one of my friend told me his dentist take 8 of his teeth. I heard 4. I think, okay, that's reasonable. But 8 teeth to be taken off is quite a lot. Can you tell us, is that really healthy for us? Or is that really necessary to just pull the teeth off? It's just very scary.
I think historically, again, traditional braces did involve taking teeth out because it was life was easier for the orthodontist.
Oh.
And that was a traditional thought process.
Okay.
In our clinic, I would say that we maybe take out between 2 and 2 teeth, maybe 4 teeth, really, if we're required, but maybe in a handful of cases in 1 year.
Oh.
98% are over here. 95%, 98% are here.
Okay.
And actually, what unfortunately we now know from these children where they had teeth out when they were younger, especially ladies in their 40s, 50s, they've got a very flattened profile, which actually looks very aged.
What do you mean flattened
Because
profile?
the teeth have been taken out, their lips and their whole lower face is sunken back.
Oh.
And therefore, actually, aesthetically, that's a compromise, I think. Because it's the fullness here that allows your lips to remain full, your smile to remain full. And so that is a big part of us learning from what was wrong historically. And I think still to some degree that traditional older practice will still do that. And ours really will try and keep their teeth in if we can help it. And the facial profile will allow. It doesn't mean you don't take any teeth out because sometimes you need to. But actually, as a rule of thumb, I think we've got to try and not take out teeth. And also, Méline, what's that linked to? Because, you know, in traditional Chinese medicine,
Yes.
the teeth at the end of the qi,
Yes, that's true.
right? And so each qi has got a tooth attached to it.
Yeah.
So when you take that out, what is actually the repercussion for that as well?
Yeah.
If you've got to take a tooth out, you've got to take a tooth out. And you will heal, and that qi will heal, and it will seal itself and the rest of it. But actually, you know, that's just in one type of thought process or one traditional medicine. Like, what does that actually mean if we are taking teeth out? And so I think we've got to think very carefully about taking teeth out in orthodontics, more so than ever.
Yeah, I'm glad it's going to that direction. And you have mentioned about night guard. That's another new concept I have learned since I've been visiting your clinic. Because when I sleep, I grind my teeth. And I didn't know about that. But over time, it's like when you keep rubbing it, it will getting shorter and shorter. And I believe I'll live at least 120 years old.
Okay, well, let's
Imagine
go for that.
if I granted for 120 years, it would be like none of them left. So can you tell us about the night guard and how will I know if I grind my teeth?
Yeah, so grinding the teeth is actually a parafunctional activity. That's something you don't know about it. And it's often done at nighttime or during periods of stress in the daytime. And our diet is actually in today's world very soft. So actually we have very little wear on our teeth. But when we talk about nighttime wear, and the bite is not right, it's like 2 cogs not syncing. They wear out much quicker.
Okay.
So if you've had braces and you've got a great bite and you're grinding, you're going to have a minimal amount of tooth substance loss.
Yeah.
if you have not got a correct bite and you're grinding, you're going to grind much quicker. And I think there's a rule of thumb that physiologically, you only grind your teeth 1.5 millimeters in 120 years.
Oh, okay. That's
Right?
good to learn.
But actually what we find is with 20, 30, 40-year-old professionals in today's world, they've already done 2.5 millimeters of wear.
Oh, how they do it so fast and efficient.
Yeah. Well, number one, the cogs aren't are together and the bite's not right. Number two, there's a lot of stress in our world.
Yes.
So often people will go through without a great sleep routine. And their sympathetic will still be firing.
Yeah.
Where we know our parasympathetic, which is the slower, not fight or flight, needs to be recognized and actually activated before bed. And so this great book, which I read called The Telomere Effect, went through a handful of things of like the sleep routine of like warm shower. We don't know when you have a bath or a warm shower, you sleep so much better.
Yes.
Then breath work before you go to bed at night, again, to change that sympathetic to parasympathetic. We've then got just reading a fiction book, which allows take you away from your world and not having any blue devices between 1 hour before you go to bed. Now, that's a big thing for most people. And then having a cool, dark room.
Yes.
So when you sort of then try and structure your day, now, when we talk about mental acuity and like focus for the day and the way we speak and the REM and the low wave speak, if you sleep that 8 hours and you've slept really well, what we know is the next day your mental acuity is actually much higher.
Yeah.
So the REM means you're spot on, and the low waves means you're going to age less.
Yes.
So actually, when someone talks about a day and the way it's set up, actually, really your day should start 1 hour before you go to bed.
Yes.
Or maybe even before that, like when are you eating and what are you eating, and then it's 1 hour before bed. But actually leaving your phone downstairs, turning your notifications off. I just think these are the simplest ways to actually get a great night's sleep, drift off, figure out, start dreaming again, and then take yourself to somewhere where you can go to bed and you have this great night of sleep, which actually means probably less grinding. Now, if you do naturally grind, and some people do, the night guard is like an orthotic in effect that you put in the foot, to correct the arch.
Yes.
So it's a very customized, made, clear retainer that then prevents you from activating your muscles of mastication to then increase in the lactic acid flow and the contractions, and therefore your sleep deprivation you're about to go through. And therefore that's even more stressful if you've not slept well.
Yes.
Whenever we're not slept well, life is just stressful the next day.
Yes.
So actually I try and then help my patients work through that, give them the night guard, talk about meditation, visiting places around the world, to go and relax themselves or get in better routines, or for certainly work on this 1 hour before they go to bed at night time. But you know how I love traveling and going to my wellness places as well. So
how long our teeth are designed for as a human being, and can we actually have our own teeth when we are around 80 or 90 years old? Because I rarely see people have their own teeth, at least in that generation.
Yeah. I think that generation had no preventive dentistry, Méline. And I just think that in our generation and below, we have so much preventive dentistry. The thing that does give me cause for concern is the amount of sugar that's so available. And so processed and so artificially put in a lot of the foods, and that's really a concern for me. And the amount of fizzy drinks that people drink, and it's just we know that that's not good, but we also know the acidic element of that is actually eroding teeth. So one of the things that I see as a trend across the whole of the country, and I would assume this is the world, is this erosive element of fizzy drinks, fizzy water, fruit juices, and this acidic component that is actually not decay, but it's the dissolution of enamel, which is leading to problems. And actually, this whole idea that we're grinding, what we're doing with all of these fizzy drinks and our acidic nature of the way we consume our carbonated drinks is we're softening the enamel, and then we're grinding it away. So there's still a combination of what is going on. And so I think there is going to be this issue coming up with increased sensitivity, increased wear, And that is what we're trying to work on, especially with the younger generations. You know, whenever I do a filling, I'll be like, okay, well, I'm doing it, but these are things you got to do, and I don't want to have to see you again.
Yes.
That would be my optimal solution for that patient. But often, as you know, it's very difficult for people to turn a corner, make those lifestyle changes, and it's easier to go and have that filling in 2 years' time or whatever that is. So I think the CEO idea that you said earlier of your body is really important. But again, if you're seeing a dentist and he's explaining actually this is a concern, I think most people actually are really intuitive. Like, okay, I've got to settle down on that. I've got to change my lifestyle on that.
Yeah.
So I think they're both mixed together in terms of the grinding with the erosion. And I think that's the future pattern that I'm definitely seeing a little bit more of in the younger generation.
Okay. So let's say if from today on, after people watching our episode, they said, done, I'm writing a contract to myself. I'm going to take good care of my oral health from now on. Do you think they have a chance to still got their teeth when they are 90 years old?
Yes, I do.
That's possible.
100%.
Oh,
I'd be
wow.
disappointed if you didn't have your teeth till you're 120 now.
Wow.
I mean, because your routines are right. You know, you've got your basics right. Every year, we see each other. I do a once over, X-rays, make sure everything's correct. We do the scans, and you know, from our preventive point of view, our technology is getting better and better. The way we can rehabilitate smiles is getting much more minimally invasive, and I don't see a stop in that in terms of the way that we're doing things in dentistry, because I think the dentistry in today's world is very organic.
Yes.
It is about moving the teeth in the right place. It's about adding to the teeth. It's about minimally invasive, and I think dentistry as a whole is in really great shape.
Yes, definitely. Let's talk about what can cause a bad enamel and bad teeth. For example, do you think alcohol or cigarette or sugar, how they influence the teeth? And if I really love them, how can I make sure after I had them that I maybe do something towards it?
Yeah, look, everybody's going to have sweets from time to time. I'm not saying that that's not going to happen, and very few have no sweets at all. But if you can keep sugar to meal times, and you have a dessert, or you have your sweet after, or a bit of chocolate after, or even a can of fizzy pop, or like a glass, I've got no issues with that.
Yes.
That's done in a bundle.
Yeah.
I think the damage with sugar happens when you have regular episodes of actually ingesting sugar.
Oh.
So on that side. Cigarettes, and I include vaping within that, is inhalation of toxic substances within your mouth. And then over a period of time, there's a high susceptibility for gum problems. And you'll often find patients who are smoking will have a lot of gum problems. They tend to not to have as much decay, but they tend to have a lot of gum problems. And I put vaping in there, and I think we will see the dangers of that with years to come. It's still very new and very fancy, but I don't think there's much difference between the two of them.
Okay.
With oral health. Then obviously we've got the oral cancer risk, which is the biggest concern with both of those. And we're seeing a vast increase in, historically in the subcontinent, we would chew betel nut and there would be tobacco in that.
Yes.
But actually, and tobacco leaves. And actually now what we're seeing is that the younger generation are actually putting tobacco pads within their upper lip for this quick hit. And so as part of our checkup, we always do an oral cancer screen. And for this younger generation, I think I'm taking they're definitely thickening their lip, and it's becoming more fibrous, which is the first step to cancer.
Yes.
Now, it doesn't mean it will go to cancer, but that fibrous nature is the first step for cellular change for that to be the case. So again, there is a risk associated with that. But I think as preventive dentistry, and this is why I want to see my patients every year, I want to do that oral cancer screen for them. And especially if they're higher risk, I think perhaps they should try and come in to see the dentist twice a year.
Yeah. Because when I imagine our gum, they are like very soft, very sensitive. And it seems like sometimes when they get a sore out of blue, that could happen, just like what happened to your skin, as you mentioned earlier. If I want to take good care of my gum, or let's say in the morning people have an ulcer, what they should do with it, and could you share us some notes on ulcer?
Yeah, so an ulcer within the mouth is a reaction either to trauma. then it can be somebody that's very stressed and run down. And in women, especially, 20% of regular ulcers, ladies who suffer from ulceration, it'll often be around the time of the month and reduced iron in their blood. So it'll be opening out, and the surface of the actual soft tissue is not forming properly. So there's a higher susceptibility for ulcer formation. So, and so it can be a variety of things, but it can also mean things that are a little bit more deeper in terms of autoimmune diseases. But in general, if it's just a simple ulcer and it's come once, then hot salt washes is the best treatment for that. So it's a cup of hot, as warm as you can take, put your finger in, and a teaspoon of salt. You're mixing that for 20 seconds and you're just moving over that surface. You'll see within 2 or 3 days that it will disappear. The caveat I should also mention is that if you've got an ulcer on the side of your tongue or the back of the throat that doesn't disappear in 3 weeks, I think you'd definitely go into your dentist quickly.
Okay.
Because that could be something a little bit more serious as well. So when you're feeling the ulcer, you'll see almost automatically between 3 to 5 days it'll disappear.
Okay.
If it's remaining more than 2 to 3 weeks, it could be something more severe. So go to your dentist.
Yes, that's interesting to learn.
Yeah.
When we think about oral health, I heard some people told me if they have a heart operation, the doctor will ask, do you have any oral health issues? Because if they have some sort of bacteria, they couldn't have operation for their heart.
Well, I think there's always been this historical link with bacteria in the mouth and the valve in the heart. And often these bacteria in the mouth can then start attaching to the valve, which make it not very efficient. So there's always been this danger and concern about the link. And so quite often, as you say, if somebody's having heart surgery or other surgery as well, they would then ask the patient to go and see their dentist and make sure their mouth is as healthy as possible.
Why?
Because it's just reducing the bad bacteria that
travel.
could go into the bloodstream and cause this problem with the heart.
Oh.
So quite often we will arrange for 2 appointments with the hygienist, make sure their mouth is clean as possible, make sure there's no infection associated with any of those teeth, and if there is, obviously we might take the tooth out in that instance if there's an infection, because they've got to be as healthy as possible for, I think, a more important operation. So, or we'll try and work on that infection to make sure they go into surgery with a reduced number of bacteria. But I think we're seeing this across the board.
Yes.
We're trying to go into all surgeries with a much healthier frame of mind. You're eating healthier, no alcohol. Just come into this surgery the best you can to give yourself the best opportunity to heal quicker.
Yes.
When we place implants, as an example, what we're trying to do is get the whole mouth healthy. And if there's any bacteria or any gum disease, any decay, whatever that might be, that is completely clean. And it has to be clean for that patient to pass through the gateway of having an dental implant. That then increases the success of the implant, but also the way that's going to heal. It's going to heal much quicker, less pain, less problems, and all the rest of it. So controlling the controllable over here often will lead to something more beautiful over here. And I think for many years there's been this connection with the mouth and the heart. And I think we see a lot of patients that before heart surgery come and see us.
But is there any patient come to you and you saw they have some issues that could indicate other bigger health issue in their body?
100%. I think that there's been a number of times that we've picked up diabetes in the mouth. I think that's our biggest one.
Diabetes?
Yeah, so all of a sudden you've got this healthy mouth, healthy patient, and all of a sudden you're seeing them 6-12 months later and they're deteriorating, and they've got some gum problems, and they're saying, no, I'm still cleaning exactly the same. And all that's happened is the immune system is dropped. And you've got this uncontrollable of sludge within their blood system that cannot control the amount of glucose in the body. And it's uncontrollable diabetes. So therefore they've got to go back to the doctor, the pills, the lifestyle management, and we will work with them to see the hygienist every 2 or 3 months, and then you'll see there'll be a rapid change in their oral health. I mean, that's just one example, but we often see dry mouth, which can be autoimmune related, white patches within the mouth, which can again be autoimmune related or more serious. and we see that the way the tongue is will often indicate a lot about the small and large intestine as well. So having worked at Guy's Hospital in the oral medicine department, the links between the tongue and the small and large intestine are so incredible. I mean, I could probably do another podcast with you on that. But yeah, I think we're so lucky as oral physicians, and that's really what we are. We're there to be a detective, to see patterns, to see problems, try and identify them as early as possible. And I think I'm so lucky to be practicing dentistry in this era that we've had so much evidence-based information that can help our patients.
I think here has a word quite popular online recently called oral microbiome. Can you tell us what it is? Because I think a lot of us don't really understand exactly what it means. Can you explain really simply?
Yeah, so oral microbiome is very simply the bacteria within your mouth. And we know there's good bacteria, and we also know there's bad bacteria.
Yes.
And we can have a significant influence on our oral microbiome by good oral hygiene instructions, not using an alcohol mouthwash, seeing the hygienist regularly, seeing your dentist at least once a year to overview everything, and also making it just one of your habits of the day to brush your teeth in the morning, scrub your tongue, and in the evening, do the little work in between the teeth, brush your teeth, scrub your tongue, and actually keep sugar to meal times, because it's the sugar within the body that actually is causing a lot of our problems in today's world.
Yeah.
Now, there's so many hidden sugars, as you know, but also there's, if you think of starch, if you think of fruit, this is all sugar. It's all glucose molecules. So trying to ensure that sugar is kept to meal times, but also restricting the amount of sugar that goes in your body, is going to allow your whole body to actually function much better.
Yeah.
And I heard by the glucose goddess, it's a bit like you overwatering a plant, and it dies.
Oh.
But there's a right amount of water you can give it. So glucose is exactly the same. So you do need a little bit of glucose, but most people are ingesting so much glucose that your white blood cells aren't be able to help you with your gum problems. You got mitochondria that not be able to function well enough, provide energy, and people are feeling very lethargic, and that can lead to other things like anxiety and mental health problems. And so we're realizing actually this glucose is the problem, not only in the mouth but across the body. So as an oral physician and working with other people, I think this is a key part of a take-home message for wellness, for longevity. It's about controlling that glucose intake.
Oh, wow. I really believe in preventative healthcare is the way to go. And one of my friends teach me a word. He said when you do those good things towards your health, no matter if you are doing health check or if you're doing, workout, it's like money in the bank.
Yes.
MIB, right? So if you do more of this type, yes, maybe one dentist visit is, I don't know how much is one dentist visit normally for a consultation.
Yeah, I think it varies from clinic to clinic, but anywhere from 60 to £100.
Yes. So you think about it, you're spending 60 to £100 to go for one visit, but it could save you a massive amount of money when you have a very serious disease or bigger problem. Yeah, thank you for sharing. And there has one thing I would love to ask. What is your secret of running such a, well-known and successful business, at the same time keep the life balance of your daily routine? So could you share with us your tips on the business side?
I think on the business side, I think and I hope that you've heard in the podcast that I'm really passionate about what I do. Yeah. And I really enjoy what I do. And the business side of it, it's just doing that 1% every day to make that business better. And I think you've got to be able to adapt, because all situations will change. It can be from personnel to the market, or your marketing needs to change. Whatever that is, I think you've got to be finger on the pulse, but being open to be able to change. I almost analogize it to sailing a boat.
Yeah.
If the wind changes, you have to tack, and you've got to change the direction that you travel in. So as an entrepreneur, I think you've got to be ready for change quickly. But also, I think there's a dedication about that time when I was creating. That I don't think I watched any TV. I like sports. I'd watch some sports. But it was a dedication from morning through to night, weekends, making sure that something I really cared for and I was passionate for, but it didn't honestly feel like work because I was enjoying that journey of creating this practice. And as we grew from 2 dentists now to 17 dentists, that whole thing was about organic growth, about patients wanting to refer their friends and family to us, understanding that this was something different. And the vision was very different. And as you've got to know me, I don't compare to any other practices. We have 152 dental practices on our road and the next one, so there's no competition. But the vision was to have this practice that was customer driven. And hopefully you can feel that as one of our patients. But that is more important than anything else, having the patient at the forefront of the treatment plan, the experience, and then you work from there. And that was something, as an entrepreneur, I was very passionate about, and I love people. So it was not difficult for me to be involved in that growth. But I think all entrepreneurs need to just be able to set a vision, work really hard, and be really single-minded and be able to adapt.
That's a really great advice on being flexible and, being passionate about what you do. And also love to ask you if you can only give one advice for overall health and longevity suggestions for our audience, what that will be for their daily routine.
Daily routine, drink warm water.
Oh.
Yeah, so drinking warm water obviously allows your enzymes to function better. Drinking cold water with food freezes your enzymes. Digestion process doesn't start. We talk a lot about qi and energy, and a lot of negative energy is put into your body if you drink cold things, cold water. And also it's been shown that it'll increase your IQ during that period as well, rather than decrease it with cold water. So trying to stay hydrated with warm water would be my biggest tip. It's the start of the digestion process in the stomach. So drinking warm water allows those enzymes to flow and to work. We know from research done, it can increase your IQ as well during that period. But I think it's just one of those things that you're not drawing negative energy into your body, and actually it'll allow your body to remain as one and allow that warm water not to create any negativity or issues as well.
Yeah, the fun fact, I did read a study. If a person who holding a warm beverage rather than the cold one, they appear to be more friendly. So
right. I love that. I usually have mine in a little flask or something like that, keeping it warm all day. But really, I think warm water is my biggest hack. Stay hydrated with warm water. Yeah.
And last not the least, one of the most important tasks of our episode today is actually got you, who are a well-known dentist, to show us exactly how we're going to brush our teeth and floss our teeth.
I love that. Okay, let's go through this. Okay, so I've got this little model which is showing so much on teeth, from dental implants through to the nerve and the root canal. So let's not get too carried away with that. But very simply, where you've got your teeth, it's actually the majority of bacteria are between the gum and the teeth. A bit like on our nail, the majority of bacteria are actually in this little crevice. So when we're brushing our teeth, it's a 45-degree angulation, and then it's a circular movement, never a scrubbing action. This scrubbing action can lead to a recession and also a little bit of wear away from your teeth. So when we're angling in, it's a circular motion movement, and you're almost doing tooth by tooth as it goes round. If you're using an electric toothbrush, you would just allow this just to go, because it's automatically be going round and round. But the 45-degree angulation is absolutely critical. And therefore we're working on the teeth, inside the teeth, and then scrubbing as we go around to make sure we're doing everything. So global cleaning, keeping an eye on where you're cleaning. I do find a lot of people will start brushing, they'll forget about brushing their teeth, and then their rhythm will be wrong. So try and make a conscious effort to get all the way around, and brush their teeth. Then my floss my tip when we're flossing is actually to wrap your floss around your third finger, not the second finger. That allows you more manual dexterity to get in between the teeth using your most two dexterous fingers.
And also another question on when we floss, right? Sometimes you will see the blood. Is that good or bad when you see the blood on the floss?
Méline, blood is good.
Okay.
Because it's telling you where infection is.
Oh.
And so we spoke about when you should brush your teeth in the morning.
Yes.
And it should always be first thing in the morning.
Mm-hmm.
The second biggest thing we find is like, yeah, my teeth are bleeding, and so therefore I've not been brushing them. But in fact, the body is saying, listen, I need to put blood to get rid of the bacteria.
Yes.
And therefore, that is the reason it's bleeding, because it's trying to get rid of bacteria. So actually, if you see blood, that's an area of infection. Brush a little bit longer, floss a little bit more regularly. Within 2 or 3 days, maybe some hot salt washes, you'll find that will disappear. And again, maybe if you're not seeing the hygienist in a while, that may be starting to happen, and she'll reset everything again.
Yeah. So
great question.
Yeah. Thank you, Dr. Samir, for today's episode. I believe our audience will get great benefits from adding some of those good habits into their daily routines.
Thank you so much for having me. It's been great fun.